Hey everyone, if you're interested in some ideas on taking care of arthritis at home and knowing treatments that most people don't know about, even doctors are coming into the office and asking for the treatments, then you should check out this video. It's on arthritis, traumatic arthritis, psoriatic, rheumatoid, and stomach arthritis. If you perceive value in the video, please like and share, and make sure that you select the bell so you'll know when the new videos are coming out. We're usually posting a couple times a week. So let's talk about arthritis. So the first one that we'd like to talk about is osteoarthritis, or what I call rust arthritis. If this is your shin bone and this is your thigh bone, what's supposed to happen is it's a hinge joint. You're supposed to have lots of space in here. If they get right on top of each other like this, there's a sensitive membrane around each bone called the periosteum. And when periosteums touch, they hurt. And that's why it's hard to go up and down stairs. That's one of the classic signs of knee arthritis. It's hard to get in and out of a car. That's a classic sign of hip arthritis. Or if you can't throw a baseball or throw a fishing rod, or you can't crochet or things, those are all signs of wearing out joints. Now, the medical treatment for those is usually some type of over-the-counter non-steroidal anti-inflammatory therapy like aspirin, Aleve, Tylenol, or ibuprofen. And guess what? Those are not exactly benign medicines. What does that mean? It means that they have a black box warning. The CDC says you should use anti-inflammatories at the least amount possible, the least dosage for the least amount of time, because they can be harmful for your body. Now, no one likes to live in pain. That's not a good suggestion or way to live either. But there's some natural things that you can do at home that'll really help with all kinds of arthritis, whether it's osteoarthritis or rheumatoid arthritis or psoriatic arthritis, autoimmune arthritis, and that's to control inflammation. So we put together a free ebook and program on arthritis. You can go get to it at the link in the description, or you can go to curingarthritis.com. It'll take you right into the program. And the reason why I wanted to do that is because I declared war on osteoarthritis, rheumatoid arthritis, because people are coming in and they're living in pain, and they don't always have to live that way, because sometimes they don't know some of the things that they're doing are really causing problems. Like for osteoarthritis, if you can reduce inflammation in the area and put good building blocks in your system, there's a way to literally lubricate that joints and to make them feel better. Now, if your arthritis is from scar tissue or traumatic, old injuries, there's a way to treat the scar tissue and to reset the nerve memory. And then we start talking about metabolic conditions like rheumatoid arthritis and psoriatic arthritis. All of those do really well when you reduce inflammation. So reduce sugar, be careful with grains, be careful with dairy. We actually have a free diet in our program called the Arthritis Diet, and it's how to basically fuel your system to not have the wrong kinds of inflammation. Now, inflammation always isn't bad, because you need the right kind of inflammation to heal. And so there's also, we talk about what you can do for that. So a couple examples: high dose essential fatty acids, 2,000 to 4,000 milligrams with a proteolytic enzyme, really help to control pain that's not over the counter. So what does that mean? So essential fatty acids like fish oil, flaxseed oil, evening primrose oil, and a proteolytic enzyme like bromelain or bromogest. You can find it in cherries and in pineapples. There's lots of places to get proteolytic enzymes, but they're like little Pac-Man. They go around and they chew up inflammation. So if you combine fats with an enzyme, it's a really nice way to pain control, but it's not instantaneous. So I want to tell everybody, hey, don't expect it to turn off like, aspirin or acetaminophen or something like that. It doesn't work that, but long-term, it's really effective. There's another really neat way to treat nerve memory associated with arthritis, and this is for all types of arthritis, whether it's bone-on-bone arthritis or metabolic arthritis, rheumatoid arthritis, and that's to reset the nerves, because your body will develop a nerve memory where it's used to being here, and your mind's telling you, hey, I used to didn't have to go up and down stairs without pain, or a couple years ago I didn't have rheumatoid arthritis, and your body starts accepting that as normal. Well, if you can reboot the system by doing a technique called neural therapy, we talk about it extensively in our free ebook and program. Neural therapy helps to reboot or get nerves to change. And then we start talking about autoimmune arthritis, ankylosing spondylitis, Sjogren's disease, rheumatoid arthritis. If it's in the joint, that's autoimmune there. If it's out to the tissues, we can start talking about fibromyalgia, mixed connective tissue disease, or MS. And the way to help that is to get the immune system to start working the right way. It's not just eliminate the immune system, and that's a lot of the traditional medical treatments, is we just eliminate all of the inflammation, and then what happens is you can get another condition or your immune system suppressed, and there's tuberculosis is a risk factor, staph is a risk factor. And so the answer to arthritis is to put your body in balance. And so many times people are doing things that they don't know is hurting themselves. So sugar, breads, certain types of grains, food allergies is a big one. Sometimes people will get sensitive to something. It causes systemic inflammation. It makes their stomach not work right. Then it moves to their joints or moves to their muscles, and they get a diagnosis of fibromyalgia or polymyalgia rheumatica. And we have lots of testimonials, not only on the channel, but inside of our free arthritis program. And we talk about what you can do to manage the inflammation, reduce it. And then there's some treatments that are really important for everybody to be aware of. Regenerative injection therapy, whether it's prolotherapy or neural prolotherapy, prolozone, platelet-rich plasma therapy, perineural injection therapy, all of these different ways that help to reset the nerves of the body. We turn them off, we open them up, close them, and get them to reset. If you inject areas with building blocks, there's a really good way for us to start to heal those joints and to get them to heal. And so there's just some wonderful treatment options and information inside the link or curingarthritis.com. Now, with rheumatoid arthritis, if you can get people to get off inflammatory foods for 90 days, it literally many times will make rheumatoid arthritis disappear. Now, it's every case is a little bit different. You do it condition by condition and patient by patient. But so many times, if you reduce inflammation, wow, the arthritis goes away. So I wanted to tell everybody about our new program, Arthritis. It's on our website, curingarthritis.com, or you can follow in the link. We talk about diets, what foods you can do, what foods are harmful for arthritis, home treatments like hot and cold contrast baths, Epsom salts, apple cider vinegar, home TENS units, and then treatments that you may not have heard about, the ultraviolet blood irradiation therapy, prolozone therapy, high-dose vitamin C and magnesium treatments. And by the way, for people that are sensitive to magnesium, you don't always have to put it in your system. You can actually, there's a wonderful cream that you can buy that's really good for pain control. There's other creams, vitamin creams, and biofreeze and stuff like that that really are significant in reducing the pain of arthritis. So the reason why we put the program together is I've declared war on arthritis. It breaks my heart when people come into the office thinking that they have to take 800 or 1200 of over-the-counter medicines, of ibuprofen, of aspirin or Aleve. Sometimes it hurts people's stomachs. Sometimes they can get away with it, or they're considering, I need to do an immunotherapy or biologic, and it's $7,000 or $8,000 a month. And sometimes their insurance covers it. Many times it doesn't. And so they're looking for options, and there's some really cost-effective ways to reduce and eliminate arthritis in people. And a lot of times people say, well, if it's so good, how come everybody's not doing it? Well, there's more and more doctors that are doing it. I specifically wrote an article for that in the inside of our program. If it's so good, why isn't everybody doing it? Or answer that question. And there's just some neat natural ways to take care of it. I also talk about supplements, because sometimes people come in the office and they'll say, hey, Dr. West, I tried, St. John's wort for nerve pain, or I tried glucosamine for my joint pain, and maybe it worked a little bit, or I just got tired of taking it, or it didn't work. And I ask them where they get it from, and they'll say, I got 500 pills at a box store for 49 cents, and I can't believe it doesn't work. Well, you kind of get what you pay for. There's some quality stuff that is really effective for pain, for muscle pain, for chronic fatigue, for fibromyalgia, for osteoarthritis. There's a wonderful sugar extract called Wilson Factor that's really effective for rheumatoid arthritis. We take sugar cane, we take all the poisons or sugar out, we give it to people, we throw away all the good stuff, and inside that good stuff, Wilson Factor that helps joint stiffness and to clean out the liver, because so many people that have arthritis, they get congested livers, they get cellular trauma, they're eating foods, maybe they don't know about it, they're causing inflammation. It's going to their liver, it blocks up the liver, the body can't process all of the inflammation. And so what happens is they feel full of guanidine and Wilson factor, and it makes them stiff, and then they can't move. And that's one of the classic signs of having a toxic liver, is you're full of guanidine, too alkaline, it causes the calcium to settle out, and then you get bone spurs and it just hurts to move. So that's our arthritis program. I wanted everybody to know about. There's natural treatments you haven't heard about, foods to eat, foods that you should avoid, what you should buy at the store, supplements that work, treatments that you haven't heard about. And then the last thing I wanted to leave you with is this. So many people get better with arthritis when they just get a little bit more water intake. So if you get nothing else from the video series, please make a conscious effort to increase your body intake of water. Try to reduce anything acid that's going in your system. It could be fruit juices. Sometimes alcohol is a factor, and soda pop is really difficult on arthritis cases. Replace it with water. Get on the right building blocks. Get some good food to eliminate inflammation in your system. You're not your diagnosis. I know there's help. I'll see you guys in the next video.